this project got started actually by accident. I was brand new in my postdoc, and in my postdoctoral fellowship, I am a scientific member of the Population Studies and Disparities Research Program, where we look at disparities in many different communities. And I was at the Michigan Cancer Consortium conference in November of 2010. I was listening to a talk where there were 4 people on the stage talking about education in hard-to-reach communities. Pop studies, the real focus is on understanding disparities in many different communities. And the reality is that Ashkenazi Jews do have a higher risk of cancer, particularly because of BRCA mutations. And the Orthodox Jewish community is a very insular, very religious community that is really kind of isolated themselves in many ways. And so their education wasn't always reaching the community the way it needed to be. This was a perfect opportunity to kind of put a community that there was a disparity into a scientific research program that was specifically looking at disparities in many different communities. We started by really putting together a community advisory board. And one of our community advisory board members had the suggestion of applying for funding from the Jewish Fund, which is a federation-affiliated program. And they were very receptive to the idea of the project. And so we had an advisory board that really spanned the community. It represented the different schools, it represented the Women's Orthodox League, it represented rabbis' wives, and it really put together a group of women that any woman in the community could identify with one of them. We started with doing focus groups, and we ran 6 focus groups, and we just had women talk. What is cancer? What is cancer genetics? What do you do to take care of your health? What do you think the health issues are in the community? And that gave us just a wealth of information. Based on that data, the second phase was we developed a survey. And what we did is we randomly selected 450 women from the Women's Orthodox League directory, and we actually got 260 returns from that male survey. And that data was just astounding. And it turned out that religion mattered a lot. It mattered a lot in terms of how people thought about their health. Based on the data, we developed a religious education program. And I contacted Mrs. Silverstein and Mrs. Schwartz because they are both health educators within our community already, and they were the perfect people to do that with. And with the help of Rabbi Neustadt, who's the head of the Council of Orthodox Rabbis, we created a program that really focused on the Torah obligation to take care of your health.
Our religious law teaches us that it's very important to take care of your health. In fact, it's mandatory to take care of yourself, and it's mandatory to listen to prevailing medical opinion.
I definitely feel that there has been a bridge between the gaps in that women, once they heard that there is an endorsement from the rabbis in being able to take care of your health and doing proper screenings, etc., that they were ready to take that step forward and be able to follow through with the aspect of taking care of your health through science as opposed to the religious, just looking at it from the religious end.
I found that the women in this community were very interested in learning more about genetics. They had a lot of questions for me, and I think questions that they weren't always comfortable asking their own doctors, and it was nice to be able to ask someone in an informal setting.
Cancer genetics was something that a lot of people were the most afraid of. We were really lucky that the resources here at Hermanos meant that we could provide some very important and crucial information about cancer genetics that really also changed the conversation.
People who have been vaguely aware of the importance of taking care of themselves have now been galvanized to not only take care of themselves, but to encourage their family members as well to make sure that they follow recommended medical practices.
I think this project really had an impact on the community in a very positive way, and I think that it's something that could be continued, and we would only feel more and more of the benefits of having such a program. I stand behind it completely, and I'm very grateful to Dr. Tikach for inviting me to be part of it.
So Hermanos already had a really good brand name in terms of cancer, but people were uncomfortable talking about Hermanos because it was so related to cancer. Obviously, it's Hermanos Cancer Institute. But what this project did was it made the community feel that Hermanos was interested in them as well. And it really made them feel like Hermanos could be the place that they go to when they have issues related to cancer.